The Western Cape Blood Service, also known as the WCBS, is one of 2 blood services that operate within South Africa. Donors and patients are its priority, whilst it facilitates the entire process of blood collection, testing, component processing, storage, distribution, and issuing of blood products.
Dear listener, welcome to another episode of the Lifeblood Podcast. I'm Hayley Ali, Hospital Liaison Officer for WCBS. Our guest today is Dr. Caroline Hilton, who is the Lead Medical Consultant for the Western Cape Blood Service. Welcome, Caroline.
Thanks so much, Hayley. Thanks for having me on your podcast.
In this episode, we will explore what haemovigilance means and its role in improving blood transfusion safety. Caroline, one just assumes that medical staff will know about haemovigilance, but please define haemovigilance for us.
Okay, so the word haemovigilance, if you break it up, hemo refers to blood and vigilance refers to the process of keeping a careful watch over something. So while we try to make blood donation and transfusion as safe as possible, unfortunately there are some risks. For example, with blood donation, some donors can faint or have bad hematomas. And in blood product transfusions, there are also multiple risks like transfusion of infection or incompatible transfusions or the unpredictable transfusion reactions that we see. So knowing that there are these risks, it's our responsibility as the blood collection service to carefully monitor all the risks associated with collecting, processing, and transfusing blood, which we do through our haemovigilance program.
Why is haemovigilance important?
So haemovigilance is important to ensure that our donors and patients are as safe as possible. So we use the haemovigilance program to identify any problematic trends or new safety risks associated with donating, processing, and transfusing blood, and we figure out how we can correct and improve these. So donor and patient safety is one of our top priorities at the blood service, and our haemovigilance program is designed to monitor these very carefully.
Explain donor safety measures at the Western Cape Blood Service.
So there are multiple layers to our safety procedures for donors at the blood collection clinics. And probably the cornerstone is the actual donor selection. So we only collect blood from what we call non-remunerated voluntary donors. And this is a very important concept of safety throughout the transfusion process. So it's important that when a donor comes to donate blood, they're doing it completely altruistically and they're not incentivized in any way. And this ensures blood safety in that a donor, seeing as they're not incentivized to donate, they wouldn't be dishonest when completing their questionnaire or going through the safety procedures that we have at the clinics. So, as I said, this is a very important part of ensuring that the blood products that we collect are safe. Secondly, we need to identify any risk in our blood donor that could compromise the safety of their blood. And we do this mainly through our questionnaire process. So if you've donated blood before, you will have to complete quite a lengthy questionnaire that looks at health factors, lifestyle factors, and personal information that could perhaps, as I said, compromise the safety of the blood that we're collecting. And we realize that donors find it quite cumbersome to complete this long questionnaire every time they donate. But this is a very important part of making sure that the blood that we collect is safe. And then secondly, the donor does go through the interview process with a professional nurse at each donation, just to make sure that they have understood the questions in the questionnaire and the nurse will review their answers. The third important part of donor safety is checking that the donor can donate blood that day and has a sufficiently high hemoglobin level. So we do point-of-care testing for hemoglobin before every donation, along with other basic checks like pulse and blood pressure. Ferritin testing is also performed at each donation for people who have made an actual donation. So the blood is collected at the time that the needle is inserted and the samples are collected for testing. And then the ferritin testing is performed at our laboratories. And the donor would be informed if their ferritin level is either too high or too low. And the reason that we do ferritin testing is that regular blood donation can cause iron deficiency in our donors. And this is something that we need to be very careful about and monitor for to prevent our donors becoming anemic and not being able to donate in the future. So we are very proud of our ferritin testing procedure, which is done at every single donation. And then we will inform the blood donor accordingly. What we also do is offer our donors iron replacement therapy after their donation. So this is only for people who've completed a donation. And it's a iron combination of ferrous bisglycinate with vitamin B12 and folate. And it's a 30-tablet supply. And this should replace the iron lost in the donation. So it's not used to treat iron deficiency in our donors. That's definitely not our role, but it is just to replace the iron that's lost in the donation. And then lastly, other general donor safety measures at our clinics. To prevent fainting, we offer hydration, so water before and after the donation. We encourage people to have a salty snack, which there's evidence to show that this can increase the blood pressure and prevent fainting. And then we also encourage our donors to perform what we call muscle tension exercises during the donation, which is clenching of the buttocks and thighs. And this is also shown to prevent fainting in donors. Otherwise, we instruct our donors to rest after the donation and have something to eat, some refreshments before they leave the clinic, so that they don't leave and perhaps have a faint on the way out. So as you can see, there are multiple ways that we do try and ensure that donation is as safe as possible.
So now we've covered donor safety measures, Caroline. Can you please explain transfusion safety measures at the Western Cape Blood Service?
Yes, absolutely. So as I mentioned earlier, transfusion of blood products, there are multiple risks associated with this. And we can't mitigate all of these, but we definitely try our best to control those that we can. So firstly, there is the risk of infection being transmitted from the donor to the patient. So we employ state-of-the-art testing of blood donor samples using nucleic acid testing on each individual donation. And the infections that we test for are HIV, hepatitis B, hepatitis C, and syphilis. So we do the NAT testing for the first 3 viral infections. And this is extremely sensitive testing that reduces the window period for HIV, for example, to about 4.6 days. So this testing, we've invested a lot in the testing, but it's absolutely imperative to try to make the blood as safe as possible. Other ways that we have tried to reduce the risk of transfusion reactions in patients is to use fresh frozen plasma only from male donors. And the reason is this is to reduce the risk of transfusion-related acute lung injury. We also only make our platelet products using platelet additive solution rather than plasma. And this is to reduce the risk of allergic reactions in patients. And then very importantly, we try hard to educate the healthcare workers in the Western Cape to employ safe transfusion practices. So we offer lecturing and teaching to the universities to make sure that the staff who are administering the blood products do so as safely as possible. And then lastly, we also produce a booklet with the South African National Blood Service called the Clinical Guidelines for the Use of Blood Products in South Africa, that again instruct people how to use products safely, give them more information about what is in the products, and how to manage the adverse reactions if they do occur.
Explain the role of the Haemovigilance committees and who comprises them.
Okay, so the Western Cape Blood Service has their own Haemovigilance committee, and we meet on a 6-monthly basis to monitor all the donor, product, and patient indicators, and to try and identify if there are any areas of concern that need to be addressed. But what actually happens on the ground is when we do have a serious donor or patient adverse reactions reported to our service, they get analyzed and investigated, and if necessary, if they meet certain criteria, they are escalated to a national Haemovigilance committee. And this is a committee that's comprised of 2 people at the moment, Professor Arthur Rantloane and Dr. Patty Knox. And they independently review all the severe reactions, as I said, from the donors or patients, in order to analyze these from a sort of non-biased point of view. And this information is reported on every year in the National Haemovigilance Report, which is compiled by the National Haemovigilance Committee. And the South African National Blood Service, who monitors in all the other province, or who manages blood collection in the rest of the country, also submits their data to the National Haemovigilance Committee. So that report is representative of the national haemovigilance statistics and information. And then in addition to this, we also have separate committees that are monitoring blood safety. We've got the Emergent Infectious Diseases Working Group, which has representatives from our service as well as SANBIS. And the purpose of this group is also to meet at 6 monthly intervals just to check whether there are any infections that we should be concerned about in terms of blood safety. So, for example, we watch malaria very closely. We would watch COVID when that happened to establish whether there's a risk to the blood supply. And then we also look at the more rare infections like chikungunya, West Nile virus, that are prevalent in other parts of the world, to see whether that risk extends to our donor base. And then lastly, there's the National Blood Safety Committee, who meets once a year, and this is to present all the haemovigilance data for the country, and there we monitor the various aspects of donor and transfusion safety.
Okay, so we've discussed the various committees, and how can we now explain the handling of transfusion-transmitted infections by the haemovigilance committees?
Okay, so when we look at transfusion-transmitted infections, fortunately, this is something that's not seen very often. And this is mainly, I think, due to the nucleic acid testing that was introduced in 2005 in the South African Blood Services. But in the event that a clinician is concerned that an infection was transmitted via blood product, we have a very specific procedure to be followed. And in that case, the clinician would report their concerns to us, and then we would track back and look at the various products that the patient received, and then follow up with each of those donors to see whether the infection that's being investigated is evident in that donor. So we would typically call the donors back for testing. In the event that the infection under question is one of the infections that we already test for, if the donor has returned and tested negative for those infections, then we can be reasonably sure that, or we can be sure that that donor was not the source of infection for the patient. But all in all, we have a very carefully designed process for these investigations, and we take them very seriously, and we will give full feedback to the clinician.
Caroline, you've mentioned before that the blood services provide transfusion safety training programs for clinical staff. Would you like to explore a bit more on that?
Yes, absolutely. So we are very willing and eager to educate as many clinical staff as possible. And we do so either through our head office. We have Haley, who's the hospital liaison officer, and she will arrange training as well as myself. We will happily provide lectures at hospitals for any type of staff members. But we do also provide training at the universities for the medical students, and would very happily come and perform training at the request of any group.
Thank you, Caroline, for helping us understand what haemovigilance is and the roles of both the blood service and medical staff at hospitals for improving blood safety for our patients and donors. Do you have a closing message for our listeners?
I think it's important for the blood users to understand that there definitely are risks associated with transfusions, and to only use blood products when necessary and appropriate for the patient. But having said that, I hope that I've given you some idea of the many ways that we try to mitigate the risks associated with collecting and transfusing blood, and that you do have confidence in the safety of the products that we supply.
Thank you. We will call it a wrap.
Thanks very much, Haley.
Thank you for listening in. Until next time, do something remarkable. Donate blood.